Hi everyone, I'm Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grades 5 to 0. Grade 5, otherwise known as normal, is when the person is able to complete full range, or in other words, throughout the available range of motion, and is able to hold against maximal resistance. The muscle is able to hold against maximal resistance. For grade 4, otherwise known as good, is when the person is able to complete the full range or the available range of motion and is able to hold against moderate resistance. So if you were to apply maximal resistance and the person breaks, that would be a grade 4, right? So it's just moderate resistance. For grade 3, otherwise known as poor, or fear rather, my apologies, is when the person is able to complete full range without manual resistance. So they're able to complete full range or go through the available range or go to any range just against gravity, in a gravity maximized position. All right. For grade 2, otherwise known as poor, is when the person is able to complete partial range. They're unable to complete the full range, just partial range, or you put them in a gravity minimized position and they're able to perform the full range in a gravity minimized position. All right. For grade 1, otherwise known as trace, is when the person just has a palpable contraction or a visible contraction. And for grade 0 is when there is no visible nor palpable contraction occurring in the muscle. And 0 is otherwise known as, you guessed it, 0. All right. So when performing MMT, you want to make sure that the body part is exposed. You don't want to have it fully clothed or you have bulky clothing over the area that will limit the range of motion, and you won't be able to see any visible muscle contraction occurring. So you want to make sure that the area is exposed and you drape them accordingly. All right. Now, in terms of, just before we go, I just want to also mention that for some joints, there may be some arthritic changes that will affect the range. So the person may not be able to perform full normal range of motion just because of arthritic changes occurring within the joint itself. May also be due to capsular issues or some internal derangements occurring in the joint. So you allow the person to take the limb through the available range that they have within their capacity, through the available range, or you take them to the end of their range. They're able to take themselves to the end of their range, and you perform the test within their available range that they have. All right. So this is MMT, manual muscle testing, that we'll be talking about. Thank you very much. I'm going to be talking about MMT, or manual muscle testing, for hip external rotation. Now, there are many muscles involved in external rotation of the hip. You have the gemini group of muscles, you have the obturator group of muscles, the gluteal group of muscles, primarily the maximus and the medius, and a little bit of the quadratus femoris, as well as the sartorius and some of the adductor muscles. All right. Now, we're going to be going into the position, the starting position of the therapist or the examiner, and the starting position for the patient. Great. So we're going to be talking about the external rotation of the hip. We have the patient here, right? We have the model here, and she's in a short sitting position. This is the starting position for this test. Short sitting position. The arms can be used to, for the bed to support the body, so it can stabilize the trunk and torso in case of anything. And with regards to the legs, so we have the bed or whatever surface that the person is sitting on. You want to make sure that the full thigh is being supported by that surface, and the legs are hanging down at the level. You want to make sure that the bed is at the level of the knee, and the legs are, in a neutral position. With regards to the examiner is sitting or stooping. It's best for the examiner to be in a chair or something like that, because they're going to be bending over for a period of time. And they're more or less to the side and front of the limb that will be tested. All right. So for external rotation, you want to ask them, where sometimes the person may not understand. So it's said that it's preferable for you to go ahead and position the limb for the patient. So you position the limb for the patient. And what will be happening is you have a counter pressure here on the outside of the knee, because this is for external rotation. And you have the hand that will be performing the test, distal leg, or at the level of the inner ankle, right? Distal leg or the level of the inner ankle. So what you're going to be, the instruction that you're going to be given is don't let me rotate it, don't let me move it out, don't let me move the leg out, keep it there, hold it there, and that will be a grade 3 to 5 for external rotation, for the hip. For her, because she didn't break under the pressure, this will be a grade 5, which is good. If it is that she breaks under maximum pressure, then that will be a grade 4. If you're using moderate resistance with it and she's able to hold properly with moderate resistance without breaking form, that will be a grade 4 also. If it is that she's unable to hold against any maximum pressure, go ahead and return the leg to neutral position and allow me to just move it into external rotation for you, moving the leg inwards towards the other leg. Hold it in that position. That alone will be a grade 3. Okay, so for grades 2 to 0, hip external rotation, the patient is lying on their back. So they're supine lying, and the position of the examiner is on the opposite side of the limb to be tested. Alright? So you want to make sure the patient is close to you. They're going to be performing external rotation of the hip. The therapist is standing at the level of the waist or at the level of the hip of the patient. And what you're going to actually do is position the foot internally rotated first. So you, the therapist or the examiner, positions the patient's examining limb in internal rotation first. And then you're going to hold it there. And then the instruction that you're going to actually give while you're stabilizing the side of the hip so that there isn't any abduction going on, any abnormal compensatory movements, the instruction that you're going to give is go ahead and roll that foot outwards something, as far outwards as you can. And there you go. So performing it once more, the examiner moves the foot inside as an internal rotation. The movement that you're testing for, the muscles that you're testing for are the external rotators. So you want to be able to see the muscles work by the movement of the limb going into full external rotation. And for you to actually do that is moving the limb internal rotated, moving the toes on the inside, moving them inside, and go ahead and rotate that foot. It's past the midline and going full into external rotation. That will be a grade 2 for hip external rotation. Alright? Now, if the person is unable to do that, you can't palpate the muscles because the muscles are too deep. So what you're looking for is signs of contraction, muscle activity going on anywhere with regards to the limb. So you're going to say try and move the toes. You're going to position it inside again, and you're going to say try and move the toes out for me, try and move the toes out, try and move the toes out. You see a little flickering going on, you see some movement going on there with the limb, and that will be a grade 1. If you don't see anything going on, no discernible movement or action going on with regards to that limb, then that will be a grade 0. And this is MMT, manual muscle testing for hip external rotation. Thank you.